Right now, inside your body, thousands of tiny molecules are telling your cells when to heal, when to grow, when to stop. You've been running on peptides your entire life. The question is, should you be able to use them intentionally? A peptide is a short chain of amino acids, fewer than 50 links. Proteins are the long version. Peptides are the messengers. Your body already makes thousands of them naturally. Insulin, a peptide. It controls your blood sugar. Oxytocin, a peptide. It drives bonding and trust. Defensins, peptides that are part of your immune defense. These aren't exotic chemicals, they're you. Synthetic peptides fall into 5 categories. Healing, BPC 157, derived from a protein in human gastric juice, studied for tissue repair, gut lining, and tendon recovery. Recovery, TB 500, supports cellular regeneration and angiogenesis. Hormonal, CJC 1295 and ipamorelin, which stimulate your body's own growth hormone release. Cognitive, Semax and Celanc, used for dopamine modulation and stress resilience. And longevity, MOTS-C, targeting aging at a cellular level. Here's what the research actually shows. BPC 157 has 35 preclinical animal studies showing it accelerates tissue repair, reduces gut inflammation, and supports nerve regeneration. One human case series showed 7 out of 12 patients had lasting pain relief. Semaglutide, a GLP-1 peptide, produced a 15% average body weight reduction in a 68-week randomized controlled trial of over 1,900 people. That's the strongest weight loss data ever recorded. CJC 1295 and ipamorelin support the body's own growth hormone cycle. GHKCU stimulates collagen synthesis, used in wound healing and now widely in medical-grade skin care. The pattern is consistent. Targeted action, body-compatible signaling. So, if this works, why isn't it approved? Honest answer. Because the FDA approval process costs between $1 billion and $2.6 billion per drug, takes 10 to 15 years, and requires large-scale human trials. Most peptides like BPC 157 aren't patentable. They're natural proteins. No patent means no exclusivity. No company will invest $2 billion because a competitor can copy it the day after approval. The system approves what it can own. Why BPC 157 will never get FDA approval? Not because it's dangerous, but because nobody can own it. Natural peptides like BPC 157 exist in your body already. That makes them nearly impossible to patent under US law. You can't own what nature made. No patent means no market exclusivity. No exclusivity means any competitor can copy the molecule the day after approval. So, why would a pharmaceutical company spend $1.26 billion and 10-15 years on clinical trials for a drug anyone can replicate for free? They wouldn't, and they don't. The FDA approval system was built around patentable molecules. Compounds that can't be owned don't get funded, don't get trialed, and don't get approved. Not because the science fails, but because the economics do. This isn't corruption. It's a system doing exactly what it was designed to do. The problem is what it wasn't designed to do: approve things that actually work, but can't be monetized. Then came the money conflict. Compounding pharmacies were making semaglutide for around $100 a month. The brand version, over $1,300. In 2023, the FDA banned compounded versions, citing the shortage was over. Novo Nordisk sued compounders for patent infringement. The FDA receives over $1 billion a year in user fees from pharmaceutical companies. And 54% of all GLP-1 patents aren't on the drug, they're on the injector pen. That's market share protection. In February 2026, RFK Jr. announced that 14 of the 19 banned peptides are coming back. On July 23rd, the FDA Advisory Committee votes on formally legalizing BPC 157, TB 500, and MOTS-C for physician-prescribed compounding. If that passes, millions get legal, supervised, affordable access to compounds already used in the gray market. The difference is safety, dosing accuracy, and medical oversight. Peptides are not a trend. They are part of your biology. Science is finally catching up with what the body already knows how to do. Some have clinical evidence. Some are caught in a commercial war. But the information exists. Now you have it. What you do with it, that's your call. Follow 5M's theory. We'll keep bringing you the science, unfiltered, just the data. Hit the bell. We'll break down the FDA vote on July 23rd.